All right, hello everyone. So we are going to do the first part lecture for Chapter 2 in your Blue Pharmacy Practice for Technicians book. This is Chapter 2 covers law, pharmacy law, regulations, and ethics. The first part about pharmacy law and ethics in this chapter goes over why do we need drug control? So medicines in the United States were unregulated in the 19th century. During this time, medicines didn't have to be proven safe or effective. So we know that our FDA, or the Food and Drug Administration, now requires that drugs, medications, over-the-counter items, such as ibuprofen, Benadryl, that type of thing, and homeopathic medications are proven both safe and effective before they're released to the market. Some products during that early 19th century contained opium and also contained high levels of alcohol. A lot of times there was injuries and death associated with a lot of these products. Obviously, the opium containing elixirs and syrups back then led to addiction, even though they didn't quite understand it back then. But that was one of the main culprits of adding opium to things. The laws and the oversight agencies, so things like the DEA, the FDA, the USP, Joint Commission, all of these different agencies and regulatory bodies were designed, developed, and created to establish safety to the public. Many agencies and organizations control or guide pharmacy practice. So there's legislatures that are both federal and state. There's federal regulatory agencies, so the Food and Drug Administration, the DEA, which is the Drug Enforcement Administration, OSHA, which is the Occupational Safety and Hazard Administration, the FTC, which is the Federal Trade Commission, CMS, which is Centers for Medicaid and Medicare Services, the CDC, which we're hearing a lot about right now during COVID-19, which is the Center for Disease Control and Prevention, and then state agencies. There's also the USP, which is the U.S. Pharmacopeal Convention, and we'll go into that a little bit more in detail, and then separate professional organizations. So looking back, federal regulatory agencies, these are the big guns, right? So DEA, FDA, OSHA, CMS, because a good portion of our population is either on Medicaid, which we call Access here in Arizona, or Medicare, CDC, obviously. Again, we hear a lot about that right now. So they are entrusted, and they are required to ensure public safety on many different levels. So the CDC is ensuring public safety with what we're dealing with right now with COVID-19. So different bacterias, different viruses, those type of things. The FDA is for food and drugs. The DEA controls and oversees all controlled substances. OSHA is designed to ensure workplace safety for employees. The Federal Trade Commission is for one of the things that we look at from a pharmacy aspect is advertising, okay? And then CMS, Centers for Medicaid and Medicare Services, oversees the entire population who is being served through federal government insurance. So CMS sets high standards for care for their patients, whether they're on Medicaid or Medicare, and dispenses. They set the regulations for who qualifies for either Medicare or Medicaid, and that type of thing. So law is a rule that is passed by the government. The law offers a minimum level of standard. A regulation is a rule and procedure that exists to carry out a law. So that's the difference between the two. You have law, which is a standard. Okay, it's a minimal level of standard that is passed by the government. The regulation is there as a procedure or a guideline to follow and carry out that specific law. So for example, the DEA regulates all aspects of controlled substances. So oversights, so standards. Standards set are a set of criteria that are used to measure quality or professional performance against a norm. So for example, the USP, or the U.S. Pharmacopeia Convention, sets drug manufacturing standards. So when we start to get heavier and deeper into the USP, some of you that have been in class for a couple sequences now have heard the term USP. You've heard the term standards of USP 797, USP 795, USP 800. The USP is the one that sets these standards. So USP 797 is a standard that comes from the U.S. Pharmacopeia Convention, or the USP, and they set the standards for 797 is for sterile compounding. So they set all of the standards that are required for any pharmacy or entity that is doing any type of sterile compounding. And what I mean by sterile compounding is when we make IVs, when we make eye drops, anything that must be done in a sterile environment. USP 795 covers non-sterile compounding. So what do I mean by non-sterile compounding? When we make things like creams and ointments and suppositories and oral suspensions, these things do not need to be compounded in a sterile environment, but there still are standards that are set to ensure that we are safely, accurately, and correctly compounding these items. USP 800 is something that we're seeing and hearing way more of now. Especially in healthcare facilities across the entire United States. Not just hospitals are affected, clinics are affected, chemotherapy clinics, all of that, because USP 800 is specific to hazardous compounding or hazardous preparation of drugs that have hazardous connections to them. So they're either hazardous when producing, they're hazardous when we're dispensing them, they're hazardous to the patient on some level. In most particular, the one that falls into that highest category are chemotherapies. Ethics. So ethics are standards of personal conduct and professional behavior that have been adopted by the pharmacy profession and associations of both pharmacists and pharmacy technicians. So when you complete your whole program, and as you're heading out to externship, you will be taking your national exam that is established by the Pharmacy Technician Certification Board. And when you take this exam and you pass, you become a certified pharmacy technician. This organization, the PTCB, as we call it, has also adopted and set its own set of guidelines for ethics and what they expect professional behavior to be displayed by pharmacy technicians. Pharmacy associations, NABP, and other of that are specific to pharmacists. With this, the ethics encompass the higher realm of ideas and values within the profession. So, it's just like a doctor when he takes his or she takes her Hippocratic oath, right, to take care of patients, to do no harm, that type of thing. Every pharmacy, every healthcare entity or profession, nursing, physicians, CNAs, LPNs, pharmacy techs, respiratory therapists, physical therapists, occupational therapists, every different aspect of healthcare and every kind of branch of healthcare has their own set of ethics and standards, and they have their own oath that they abide by. So going into history of U.S. statutory pharmacy law and oversight, so the first thing we're going to look at is the Pure Food and Drug Act of 1906. This is on slide 10 of your PowerPoint. So this was kind of the first attempt at making any laws and regulations that curbed or restricted certain production of items, sale of items, and that type of thing. So part of this act was that it prohibited interstate transportation or the sale of adulterated or misbranded drugs. Also food. They required labels to tell the truth and not contain false information about the drug's strength or purity. So if you think back to some of those old movies you've watched, and especially set back into the 18 and early 1900s. Sometimes you see where it says, come get Magic Sally's cure-all tincture. They would say, it cures every ailment you have, from headaches to stomach aches to bruises and all of that. That was never proven, and this act was established to take that away. So we didn't want to have any type of medication or dietary supplement or anything like that was out on the market that claimed that it was a cure-all, or that it claimed to do things that it didn't do or wasn't proven to do. Also, to ensure that whatever labeling was included on the bottle, the packaging, or whatever it was, that packaging was accurate. So if it was a tincture that had 10% of some kind of plant-based thing, that it stated that there was 10% of this plant-based in there. This also prompted, and this is not a wives' tale, it is true, Coca-Cola to change its original ingredient, active ingredient, from cocaine to caffeine. So there was a period of time where my children are all, my husband, big eyes. It's true. Their Coca-Cola did contain cocaine at one point. And so this act, so we're going back to 1906, prompted them to have to change the active ingredient from cocaine to caffeine. Unfortunately, with this particular act, that it was ultimately proved to be unenforceable. There's still no cocaine in there, though. So the Federal Food and Drug Cosmetic Act, or the FD&C Act of 1938. Okay, so we went from 1906 to 1938. That was the gap in between the first passing of the first Food and Act bill to now 1938. And again, the first one of 1906 was proved to be ultimately unenforceable. So as time went on, they knew that they needed to pass something out. So in 1938, the passing of the FD&C Act was actually a result after 100 people died from sulfa-containing products, or sulfa products that were actually made and compounded with the chemical that they found in antifreeze. So at that point, they knew, okay, we have to bring back some sort of regulations that just doesn't let any, person off the street compounding things that could be putting potentially harmful products in and allowing them to distribute them for public use. So the FD&C, or the Federal Food and Drug Cosmetic Act of 1938, was the act that established the FDA. Okay, you need to know that. This act created the FDA, or the Food and Drug Administration. It required all manufacturers to file a new drug application. So we kind of looked at that a little bit in chemistry, those of you that were there for that sequence with me. It's also known as an NDA, so a new drug application for FDA approval. So what is an NDA? So kind of what we're seeing right now with COVID-19, okay, and you hear that they're saying it's going to be 12 months to 18 months for a new vaccine. The reason for that is there's steps and protocols that need to be taken for the Food and Drug Administration, or the FDA, to approve that. So anytime a new drug manufacturer or a new drug researcher has developed a new drug and they want to bring it to the market, they have to file a new drug application with the FDA. This is a very long, lengthy process. It doesn't happen in 1 or 2 years. It's over a process of a very, very long time. It costs a lot of money for these drug manufacturers to bring new drugs to the market. So they have to file an NDA, which shows that they're anticipating or planning on bringing out a new drug to the market, and they have to do the human clinical drug trials at that point. This act also required that drugs be proven safe. Okay, so here's the kicker. We know now that the FDA requires drugs to not only be safe, but also effective. That addition comes later on, but according to just the FD&C Act of 1938, all they had to do was prove that the drugs were safe for use. and it did not require them to prove effectiveness. It also outlawed adulterated or misbranded drugs. So again, if someone was repackaging something, or they had taken an original tablet of ibuprofen and recompounded it into something else that's been adulterated, it's been changed from its original chemical structure or its original form into something else, or has been relabeled or renamed something else, and this act has outlawed that. So the last one we're going to do up through, and again, this is just, we're going to go from slides 1 through 12. So this is what you need to review first in the PowerPoint when you go back and look at that. So it's continuing the FD&C Act of 1938. So again, it's going to break down specifically what is an adulterated product. So an adulterated product is something that is inconsistent in strength, quality, and purity. Diluted. It could be diluted or contaminated with other drugs or other chemicals that may or may not be harmful. So just recently, in the last couple of years, there was examples of that actually came in from China. These were heparin vials that were contaminated with chondroitin. Chondroitin is a natural supplement that people use for joint pain or arthritis. It's an herbal preparation. It's a dietary supplement. And when these came into the United States, it was discovered that it wasn't just heparin in the vial, like it was labeled, that there was actually chondroitin mixed in there as well. Misbranded is a product whose label contains false or inaccurate statements about the identity of the drug or its actual ingredients on the inside. So, a couple things just to remind you and get you kind of on topic here. So we are kind of in a perfect opportunity with what we're going through with COVID-19 right now, to kind of see how the FDA is working. So we know that there's been certain drugs that the news media has been coming out and talking about. We've heard Dr. Fauci and even President Trump talk about these things. They've been used in other countries, but part of our process is different. So hydroxychloroquine is one of the drugs. They have been also using azithromycin, which is typically, it's the Z-Pak. It's for bacterial infections. They're not using it to treat COVID itself because COVID is a virus, but the azithromycin is being used to help treat that secondary pneumonia, which is what's been proving fatal for most patients that have passed away from COVID-19. So why, most people stop and think, well, why? If they're, Italy's saying it's working, and even doctors in the United States is working, why can't we just, mass produce it and give it to everybody? There's a science to this. There's a requirement to that, and that's where the Food and Drug Administration comes into play. Hydroxychloroquine can have lethal effects for certain people with heart conditions. They use hydroxychloroquine right now for people that have certain autoimmune diseases. It's been around, but we can't just on the fly start prescribing this to all of our COVID-19 patients, because there has to be some sort of controlled study done. If we just start prescribing it to everybody, we don't know if it's truly working, or if we're becoming to a point where our United States is heading into the late spring and summer months, and maybe that's making the virus go away. So they have to really do controlled studies on this, and that's what they're doing in New York and other hot spots. Is they're prescribing it, they're doing a controlled blind study where certain patients are getting it, certain patients are not, and it's very typical to what they do in a human clinical trial. So we have to abide by the guidelines of the FDA. They can fast track certain things, but we really don't want them to just develop a vaccine and start giving it to people within 3 months if it has not been tested. Because what if later on down the road they find out that the vaccine, it works, but it's killed off everybody because our bodies didn't react to it the way that it should have. So there still has to be some sort of regulatory phases in there that prevent anyone, including our government and including our doctors and our physicians, no matter how desperate we are, to being just willy-nilly, prescribing and giving patients stuff. There's a has to be some control behind the madness, and we're panicking and we're scared, and that's all natural. None of us, most of us, have never faced something like this in our entire lifetime. In fact, 1918 was the last time we've ever seen a pandemic, and that was with the Spanish flu, and what we're dealing with is something completely different. It's a virus, but it is nothing like the flu virus. So that's why things are moving kind of a lot slower than anybody hopes to or anybody wants to, but there also has to be safety behind everything as well. So I think this is kind of a perfect time for us to be segueing into the pharmacy law, because it may also help you understand why decisions are being made the way they are in terms of medications, in terms of vaccines, in terms of specific treatments for COVID-19, and also why we're still doing the social distancing and things like that. Tomorrow we'll pick up back onto slide 10 and to slide 11 for our second day lecture, and until then, I hope you guys have a great day.